Now let's dig deeper with the panel. Board-certified cosmetic and plastic surgeon Dr. Kasssir, and board-certified dermatologist and skin surgeon Dr. Michelle Henry. Thank you both for being here. Dr. Kasssir, I'd like to start with you. So vampire facials, as we heard Nancy report, aren't FDA approved for strictly cosmetic purposes. Is that due to the risks involved?
It's not only due to the risks involved, there just has to be enough scientific research to prove that there's a benefit. So once the FDA gets the correct amount of studies, then it can declare whether it deems it safe for aesthetic use. It's used for wound healing and a few other things, but for aesthetic use, they don't have FDA approval yet.
And Dr. Henry, these facials became popular in part because of celebrity endorsements. What do you make of the fascination with trendy procedures? Do a lot of patients sacrifice safety to keep up with these trends?
You know, absolutely. When something becomes a trend, there's a push. And oftentimes, providers or patients may overlook a lot of those safety protocols that are in place. So you want to make sure you're looking for someone that is board certified, appropriately credentialed in your state, because that training not only makes sure they can make sure you have an effective procedure, but a safe procedure, that they're abiding by the very important protocols so that we don't get this sort of cross-contamination that was seen in this case.
And I think it's important to talk about a new proposal that would allow patients to hide or redact some of their medical history from doctors. So, Dr. Kasssir, the regulators that are proposing this say it could help improve the transparency of electronic medical records. Do you agree with that statement?
I think it's important for medical practitioners to have all of the information, because if you redact some of it, that could lead to prescription medicines that may be wrong, and you're missing pieces of the actual story, so you can't make a proper treatment recommendation.
Absolutely. And Dr. Henry, are there valid reasons, may there be, for a patient to want something redacted from their records?
You know, I really believe that patient privacy is sacrosanct. You know, it's a part of having a functioning healthcare system and a functioning patient-physician relationship. But I don't see where this applies. You know, what's really important is that patients understand that we have systems in place to protect them, that we strengthen our privacy rules. But allowing a patient to redact or change information, patients aren't trained to know what we need to know. And I think it's going to take us away from providing that individualized, personalized care that every patient deserves. So I don't see a place where this would really help medicine. I think that we should have more privacy. We should allow for, physicians to add subtext and subnotes for clarification, but removing information really is going to harm healthcare and essentially harm patients.
Understood. And Dr. Kasssir, I think this is the heart of the argument. Should patient and doctor safety outweigh the right to privacy?
I mean, for us, patient safety is number one above all else. So, patient privacy sometimes can end up hurting the patient clinically.
And Dr. Henry, do you have a response?
You know, I absolutely agree. And I don't necessarily think this is compromising the spirit of patient privacy. The spirit of patient privacy is to keep patients safe, to not violate what is best for them overall. I think that fortifying the trust in our system is going to keep patients safe. And I think what's going to happen is they're going to retract a lot of things that are maybe stigmatized. They're going to retract things they're embarrassed of. And that hurts our system if we double down and stigmatize these conditions further. I think what helps patients is to make sure that they understand that we are unbiased, objective physicians and providers, and that what is best is to strengthen that trusting relationship. So I think it's kind of going against the spirit of all the laws that we create, and that spirit is really to make patients safer and make healthcare better.
All right, a great debate. Dr. Kasssir, Dr. Henry, thank you both for joining us.